It was winter, 1915. The snow was falling quietly in a small town in Vermont. Inside a wooden cabin that doubled as a clinic, Dr. James Carton, a quiet man with spectacles too big for his nose, opened his notebook and scribbled 5 odd words that no one else noticed. Cranberry. Twice weekly. Calms vessels. Remarkable. He had just treated a retired railway worker who had chronic chest tightness. Nothing worked, not vinegar compresses, not tonic elixirs, until he tried one thing: pure cranberry infusion, steeped and served warm, twice a week. The man's symptoms faded. His pulse steadied. His face lit up again. But Dr. Carton's note was never published and buried under wars, new pills, and louder voices. Now, more than a century later, science is catching up with old wisdom. And that's where I come in. My name is Harold Bennett. I'm 76. A former history teacher. And I nearly died because I ignored the soft warnings of my own body. I used to laugh at cranberry juice. It was that tart little drink they served on airplanes. I thought of it as something you mix with vodka at parties. In the morning, I woke up on the floor. My heart had stuttered. My breath was shallow. And for a terrifying minute, I couldn't feel my left arm. I survived. But barely. The cardiologist looked at my chart, then looked at me and said, "Mr. Bennett, your arteries are inflamed. Your blood pressure is unpredictable. You need to rethink everything, starting with what's on your plate." Then he paused, smiled slightly, and added, "Have you ever heard of anthocyanins?" I blinked. "Try cranberry juice. Pure. No sugar. Twice a week. That's where we'll start. \n. I thought he was joking. But deep down, something about it felt familiar. That night, I dug through a box of old books I kept from my teaching days. And there it was, a facsimile of early 20th century health journals. Inside it, a reproduction of Dr. Carton's notes. The same prescription. The same fruit. I stared at the page, my heart pounding. 2 men. 100 years apart. Same advice. So I started drinking cranberry juice twice a week. No fancy brands. Just raw, bitter juice. Within a month, I noticed something strange. I walked farther without losing my breath. My fingers stopped tingling. I slept through the night. Coincidence? Maybe. But what if it isn't? What if something as simple as this, a forgotten fruit, a faded note, holds a piece of the puzzle we've all been missing? In the next 30 minutes, I'll take you on this journey. We'll explore the history, the science, and the practical steps. And maybe, just maybe, give your heart a quiet gift that could last a lifetime. For most of my life, I thought I was doing everything right. Oatmeal in the morning. A brisk walk in the afternoon. Take multivitamins before bed. I avoided red meat. Drank plenty of water. I even skipped salt on my eggs. But I had no idea that something more dangerous was quietly building inside me, silent inflammation in my arteries. That was my blind spot. And it nearly cost me everything. I remember the day clearly, February 3, 2016. I collapsed after my afternoon walk. The ambulance came. I barely made it to the hospital. The cardiologist who saw me, Dr. Rachel Kim, from Mount Sinai, looked at my charts and shook her head gently. "Mr. Bennett," she said, "you've been healthy by the book. But the book is missing a few pages." I asked her what she meant. And that's when she introduced me to something I had never heard of: chronic endothelial inflammation. The lining of my blood vessels, the endothelium, had been under attack for years, not from fat or salt, but from stress, poor sleep, and a lack of one crucial group of nutrients, anthocyanins. I blinked. "What's that?" She smiled and pulled out a study on her tablet, Anthocyanin Intake and Endothelial Function, a Meta-Analysis, AHA Journal, 2021. The headline: Berry compounds were shown to improve arterial elasticity and reduce markers of vascular inflammation. She turned the screen toward me and said, "Cranberries. Dark berries. They're not just food. They're medicine. And you've been starving your blood vessels." I felt like a fool. For decades, I'd focused on cholesterol and sodium, the loud villains. But I ignored the quiet assassin, inflammation. Do you know what your endothelium feels like when it's inflamed? Nothing. Until it's too late. After that, I began to research obsessively. I read every AHA guideline. Every PubMed paper I could find on vascular inflammation and diet. And one thing kept showing up. Cranberry juice. Not the sweet cocktail mix you find at the store. But the bitter, pure extract. I asked Dr. Kim, "Is that enough?" She said, "It's a start. 2 glasses a week. Consistency is key. But most of all, believe in it. Commit to it." I did. And within 3 months, my systolic pressure dropped by 11 points. But more than the numbers, I felt sharper. Calmer. More in control. It wasn't just the juice. It was the awareness, the shift in mindset. And that's what I want to share with you now. Not just a recipe. Not just an old note. But a lesson I had to nearly die to learn. What do you do after you've been told your arteries are inflamed, and your lifestyle, the one you thought was healthy, is part of the problem? That question haunted me. Dr. Kim didn't just give me a lecture. She handed me a 7-day tracker, a printed guideline from the American Heart Association, and a single sentence. Start simple. Start with cranberry. So I did. And I want to walk you through exactly what I did, not as a doctor, not as a health guru, but as a 76-year-old man who didn't know better until it was nearly too late. The first time I drank pure cranberry juice, I nearly spat it out. Bitter, sour, intense. But I stuck with it. And that bitter sip became the sweetest habit of my life. On day 1, I drank 4 ounces before breakfast. It burned my throat. On day 2, I added a pinch of cinnamon. Still bitter, but warming. On day 3, I poured it over crushed ice and took a walk in the park while sipping it. By week 2, it became a ritual, Harold's Hour, I called it. A quiet moment with my cranberry, my porch, and my breath. But here's the interesting part. Around day 15, I felt something subtle but undeniable. My hands stopped trembling. I could button my shirt without fumbling. I slept more deeply. My morning walk felt easier. I logged everything. I used the 30-day endothelium tracker, the one Dr. Kim gave me. It tracked blood pressure, mood, energy, and sleep quality. You can download the same PDF in the link below. Now here's the science. In 2021, the AHA released a dietary pattern update that emphasized polyphenol-rich foods, especially berries, for arterial repair and blood pressure regulation. One meta-analysis from the Nutrients Journal, August 2021, concluded. Daily intake of anthocyanins correlates with reduced C-reactive protein and improved flow-mediated dilation. In plain terms, it means anthocyanins, found in cranberries, can reduce inflammation markers and help your blood vessels expand better. That's not folk medicine, that's peer-reviewed data. It wasn't overnight. But by week 4, my systolic pressure dropped from 146 to 134. And more than that, I felt like I had authority over my health again. Not controlled. No one controls everything. But agency, the ability to act with clarity, not fear. And if I could go back to the Harold of 5 years ago, the one who thought cranberry juice was just for holidays, I'd say this. The bitter taste you avoid today might save your heart tomorrow. If you want to try this for yourself, I've put together a 30-day cranberry challenge. Simple instructions. Daily checklist. No jargon. It's free. It's printable. And it might be your quiet breakthrough, too. By week 4, I had numbers on paper, better blood pressure, steadier sleep, but it was something else that hit me. It was the mirror. I looked at myself one morning and realized, I looked calm. Not just less stressed, but less inflamed. Less puffiness on my face. Clearer eyes. I hadn't seen that man in years. That was the moment it stopped being a diet and started being a decision. I wanted to go deeper. I asked Dr. Kim, what else can I do to support my endothelium? She smiled and said, now you're asking the right question. She introduced me to what she called the vascular trio. 1. Polyphenol, like in cranberries and blueberries. 2. Nitric oxide boosters, from leafy greens and beets. 3. Omega-3s, from fatty fish or walnuts. And she showed me how the AHA's 2021 lifestyle update emphasized these 3 as core to reversing endothelial dysfunction, not just managing it. She said, cranberry is your gateway. Now build a system. So I created a 3-part rhythm for myself. I didn't change everything overnight. I changed 3 small things, and I did them every day, until my body stopped whispering warnings. 1. Cranberry juice on Mondays and Thursdays. 2. A spinach beet salad 3 times a week. 3. 1 handful of walnuts every night with chamomile tea. That was it. I didn't cut out joy. I didn't starve myself. I added what was missing. And for the first time in years, I wasn't afraid of the next blood test. One evening, I sat on the porch, watching the sunset over the trees. My wife brought me a folded envelope. It was the latest lab results. I opened it. My CRP, the marker of inflammation, had dropped from 4.1 to 1.8. I stared at the number, then stared at the glass in my hand. That bitter red liquid. And I thought. You don't need a miracle. You need a method. That's why I created a printable version of my exact 30-day rhythm, the same plan I followed. You can download it below. I also added a new section to our Healthy with Harold Facebook group, a weekly check-in thread. If you want to join, we'd love to see your updates. You don't need to do it alone. I sure didn't. That day on the porch, with the lab results in my hand, I didn't feel victorious. I felt humbled. Because I realized something, I hadn't discovered anything new. I had simply remembered something old. 100 years ago, Dr. Carton scribbled those words in his journal. Cranberry. Twice weekly. Calms vessels. And a century later, a cardiologist in Manhattan said nearly the same thing. The wisdom you need isn't missing. It's just buried under trends, fear, and noise. I was just lucky enough, and scared enough, to dig it up again. And I'm not sharing this because I think I've figured it all out. I'm sharing this because maybe you haven't had your wake-up call yet. And I don't want you to wait for one. So here's what I'd suggest, from one stubborn elder to another. 1. Start small. 2 glasses a week. Unsweetened cranberry. Keep it simple. 2. Track what matters. Not just numbers, but how you feel. Use the 30-day tracker in the link. 3. Don't go it alone. Join our Facebook group. Share your journey. See others. You're not strange. You're not behind. You're healing. Don't let your first symptom be your last warning. If you've watched this far, I want to thank you, truly. Because you've done what many won't, you've stayed. You've listened. You've remembered. And now, maybe, you're ready to return to something simple. Something bitter. Something ancient. Something red, and alive, that flows through your arteries like a quiet prayer. So before you go, here's your challenge. 30 days. 2 glasses a week. 1 printable. 1 promise. Let's do this together. Join Healthy with Harold on Facebook. Print your tracker. Leave a comment below with "I'm in." Because you don't need to be a doctor to make the right decision. You just need to start with 1 sip. So let's take a breath. And let's remember what we've uncovered together over the past half hour. It began in 1915, with a forgotten doctor in a cold Vermont cabin, scribbling a note no one took seriously. It moved through time to a stubborn old man, me, who thought cranberry juice was just for Thanksgiving. It took a scare, a brilliant doctor, and a bitter taste to wake me up. And now here we are, you and I, having walked this road of rediscovery together. What if healing isn't about adding more, but returning to what we've ignored? We talked about inflammation, the quiet fire inside your arteries. About anthocyanins, the plant pigments science is finally starting to respect. About the endothelium, your body's most important forgotten organ. You've seen how a simple shift, 2 glasses a week, could ripple through your health, your habits, your hope. And you've heard the numbers. You've seen the tracker. You've downloaded the PDF, I hope. But more than that, I hope you felt something. Because this isn't just about cranberry. It's about remembering you're still the author of your own story. And if you've been living in fear, in confusion, or just in noise, this is your invitation to press pause. To choose slowly. To choose deeply. To choose again. I don't have all the answers. But I do have this. A glass in my hand. A rhythm in my life. And a community that grows every day. If you're still with me, let me leave you with this. Health isn't a sprint. It's a slow letter to your future self. And every sip you take, every note you track, every post you share, it is a sentence in that letter. So, will you write it with me? Click the pinned comment for the tracker, the group, and the challenge. And if this video meant something to you, pass it forward. Share it with someone you love. Someone who's still skipping their checkups. Someone who needs a quiet reminder that it's never too late to begin again. I'm Harold. I'm still here. And I hope to see you in the group.